A lot of things can affect female fertility. Check the article Issues that can prevent pregnancy if you want to understand them all. Two important factors are your ovulation and your hormonal balance. If you don't ovulate at all, you can't become pregnant. And if you ovulate irregularly, it can be difficult to predict when it's about to happen in order to time intercourse correctly. A hormonal imbalance can come in many forms and have many different underlying causes. It can cause ovulation issues, but also other type of issues that can make it harder to become pregnant or keep a pregnancy. And now you're going to wonder, how do I know if my hormonal balance is off or not? This is where your cycle comes in. The cycle is a great diagnostic tool because an irregular cycle tells you that something is not working as it should, often with your hormones. So, what's an irregular cycle? First of all, it's important to emphasize that temporary changes is nothing to worry about. It is continuous irregularities that should be looked at. And with irregularities, we mean if you have a cycle that is longer than 35 days, shorter than 21 days, or if the length varies more than 7 to 10 days from cycle to cycle. Also the luteal phase, which is the number of days between ovulation and the next period, shouldn't be shorter than 10 days. So if you want to track your cycle, do that for 3 consecutive months. You may notice irregularities, if there are any. It's particularly useful to use the cycle as a diagnostic tool, because measuring hormone levels with a blood test can be tricky. Hormone values vary throughout the cycle and have to be measured on a specific day. And even if you measure on that day, they can be very volatile, leaving you with varying results in different cycles. In addition, the hormone reference ranges are broad, and sometimes doctors have to look both at symptoms and hormone values in order to assess correctly. If you do have an irregular cycle or no cycle at all, you should always get help to identify the underlying cause. Because only when you know the cause, you can take action to improve it in an efficient way. Everything we do, stress levels, what and how much we eat, and so on, affect our hormone levels. So the good news is, we can often improve our levels. Lastly, remember that hormonal imbalances do not only affect ovulation and fertility, but often also our general well-being.